Welcome to Baptist Medical News Network. I'm Terry McCarver. Thank you for joining us today for our live seminar. Our topic today is all about mammograms from A to Z, and our speaker is Donna Lustig, manager of the Baptist Breast Health Center. Thank you for coming today, Donna.
You're welcome.
Before we get started, we have 3 quick housekeeping issues. First, you can post a question for Donna at any time during the broadcast, but we're going to begin answering questions a little later. But by posting, you can start those right now. To post a question, go to our website at www.mbhs.org/mednewslive. Scroll to the bottom of the page, complete the form that's titled Leave a Reply. But after you submit your question, to resume viewing the broadcast, you'll need to hit the play button on your broadcast viewer. The second thing, during the broadcast, you'll see some advertising scrolling on your viewer. These ads are paid to the website that made it possible to put live video on the internet. These ads are not affiliated with Baptist in any way. And third, after this webcast is over, a recorded version of it will be available on our website at www.mbhs.org/mednews. Just click on the link that said Med News Live and you'll be able to see all of our previously recorded webcasts. You might have friends who would benefit from this. Let's go ahead, Donna. First of all, let's start at the beginning. Why is it important for women to get mammograms, and when should they begin?
Well, Terry, the most important thing about a mammogram is that it is the best way to detect a breast cancer at its very earliest stages, sometimes as long as 5 years before it can be felt. And women should begin to get their mammogram, their baseline, between the age of 35 and 40. After the age of 40, the American Cancer Society recommends that you get a mammogram once a year. The only exception to that is that if you have a real strong family history of breast cancer, specifically a mother or a sister who was diagnosed under the age of 50, you might want to start getting your mammogram when you turn 30 instead of waiting until you turn 40.
Okay, so say a woman has just turned 40 and she's about to have her first mammogram. Tell us what she needs to do to prepare for this and what can she expect to happen that day.
Well, there's really no preparation for a mammogram. She does need to go see her physician and have a clinical breast exam to make sure that her physician does not feel anything in her breast. A screening mammogram is strictly for a patient that is asymptomatic, meaning they're not having any clinical problems with their breast. Then they make an appointment at an imaging center and come in to have their mammogram. And what she can expect is, first of all, a thorough explanation by the technologist that's doing the mammogram. The technologist will take a good medical history about her breast health. The patient needs to know her family history. That's very important when we start talking to patients and examining a patient with a mammogram. And then the technologist will talk her through the procedure from beginning to end. So her anxiety level is going to be a little bit high. That's perfectly normal. But we're trained as technologists to help relieve that anxiety and to walk that patient through that procedure.
I guess one of the questions that I get asked the most is, are mammograms painful?
They are uncomfortable. That's what I try to tell patients. A mammogram should not be excruciatingly painful. If it is, it's not being done correctly. But mammograms are uncomfortable. There's no way around that. It's a tight squeeze. It only lasts a couple of seconds. But it is uncomfortable, and I tell patients, you talk to me, let me know if this is beginning to be unbearable for you, because it should not be unbearable.
What if a woman's had breast surgery, like either a reduction or implants or maybe a previous lumpectomy? Is there anything special that she should know about or she should do before the mammogram?
What she should know is that anytime there is any kind of surgery done to your breast or any other part of your body for that matter, it changes the structures in your breast. So if she has been having mammograms and she has any kind of surgery or reduction or implants, The next time she goes for a mammogram, it's going to be like her very first mammogram all over again, because the breasts are going to look entirely different. The structures of the breast have been moved around, and when they compare them with the previous mammograms, it's just like looking at a totally different patient.
Okay. If a woman's still having a period, does it make a difference when she comes or schedules for her mammogram?
It does. Usually the breasts are most tender right before a woman starts her period. So I would suggest waiting for at least 5 days. And you don't want to wait too much longer than that, because again, you have hormonal changes that occur within the breast, especially in women who are of childbearing age. So if you try to get it done around the same time every year, if you can remember that, then that it lessens the risk of seeing changes that normally would be just hormonal changes that are going to go away.
Mm-hmm.
So if you can remember that and say, well, I'm going to have my mammogram 5 days after I start my period, or a week after I start my period, and just kind of remember that's when you had it done from 1 year to the next.
Okay. I hear of some women that have to have a second image done or another image done. What is the reason for that?
Well, that's usually a radiologist call.
Mm-hmm.
He has seen something on that mammogram that looks different from the previous years, and he wants to see if that's a real finding, or if it's just a positional thing, or a change in the amount of compression that was used from 1 year to the next. So he will ask the technologist to go back and do a different projection. It could be a different angle on the equipment. It could be positioning your breast in a different way, or it could be doing what we call a spot compression, which is just a cone down on one little area of the breast. And it's all done to help him make a final determination and give you a final assessment on your mammogram.
But it's done usually that day. You don't leave the
We do it at our facility the same day. Now, a lot of facilities do screening mammograms. They do the 4-view mammogram and let the patient go, and they're read at some point in time in the future. It could be later that afternoon, it could be the next day, it could be 2 or 3 days later. We don't do that at our facility. If we have your previous films, then we read your mammogram while you're there. We give you the option of having your additional views and an ultrasound, if necessary, done while you're there, so that you can get your results in your hand when you walk out the door.
That is invaluable to get
It is. Most women really appreciate that. They really do. It cuts down a lot of anxiety, and it also saves you time because you don't have to come back for another appointment.
I think the anxiety is the big thing.
It
Going
is.
home on a
It
Friday
is.
and not knowing, that's huge. If there is an abnormal finding on a screening mammogram, what does it usually mean?
Most of the time, it's a benign finding. I would say probably 90% of the time, it's something that is benign. It is a normal expectation in the breast, changes in the breast tissue, because our breast tissue changes throughout our whole life.
Mm-hmm.
And it very rarely is it going to result in a biopsy, but sometimes it does. And that's the reason for doing a mammogram, is to catch those changes at their very earliest state, before they can be felt or before you have any symptoms from them.
And so I guess the next question would be, what is the difference between a screening mammogram and a diagnostic mammogram?
That's a great question, Terry. A screening mammogram is done once a year. It's done on women who are not having any clinical problems at all. That means they don't feel anything in their breast. They're not having any kind of physical changes with their breast. They're not having any breast pain. nothing. They're just coming in for their annual screening. A diagnostic mammogram, on the other hand, is totally different, and we approach those women with a totally different point of view. Those women have had they have a definite clinical finding in their breast. Either they have felt something in their breast, or their doctor has felt something, or they've noticed a change in their skin or the shape of their breast, or they're having pain that's never been there before. And that lets us know that there is definitely some specific thing that we're looking for. And we really go the extra mile to work that patient up.
Okay. One question before we close is that I know when we come to your facility, and I recently have just had my mammogram, tell me about the robe. And for a person who's never had a mammogram, that's a big thing of I'm going to get undressed in front of these. Tell me about the privacy issues that you all deal with.
We have real rooms that a patient goes in to change. It's not a stall with a curtain. It's not like a changing room in a department store. It's a real dressing room that has a full closed door. We ask our patients to undress from the waist up. They do have to remove any deodorant, lotion, powder, anything that might be on their skin. And we do give them warmed wipes to use for that. And then we have a soft cotton robe, full-length robe that wraps and ties in the front, very similar to a bathrobe that you would have at home. And that allows us, when we take the patient in the room and do their mammogram, to just expose one side at a time. Saves their privacy and lets them maintain a little bit of dignity, which is hard to do when you're having a mammogram.
True, that's true. Well, Baptist has a number of events already underway, and they're coming up next month for our Breast Cancer Awareness Month. But Donna, I want you to tell us about our low-cost screening mammogram plan that we have going on now.
This is a new plan that we've just started. It's a one inclusive fee. It's $180, and that includes the radiologist interpretation. And the women that we're trying to target with this are women that don't have any insurance, or women who have insurance, but they either have a real high deductible or they have no wellness benefits with their insurance. And we have found that these are the women who are avoiding having their mammograms done because it's too expensive. So we thought we would try to offer this low-cost screening and try to capture these women and give them the opportunity to come on in and get their mammogram done on a regular basis.
That's great. Have you had a good response?
We have not, so far we've not had anybody. We've had some calls, but to my knowledge we've not had anybody make an appointment.
And I think that's so sad because, again, early detection is the key to breast cancer.
It is, and we do want patients to see their physician before they come for their mammogram. And that may be a little bit of why we're seeing a little bit of delay since we just started first advertising this, because we do want women to go and see their physician and have a clinical breast exam and come to us with a physician's order to have the mammogram done.
Okay. And we have a number of special events coming up next month for breast cancer awareness. We have the 4 Tuesdays in October, the Positive Ones Breast Cancer Support Group, Pink Lemonade Day. All of those you can go to our Baptist Helpline to call and register at 601-948-6262 or our toll-free number at 1-800-948-6262. Another event is the Power of Pink. There's no registration required for this event, but it's all day on October the 26th at Highland Village Shopping Center. Come out and join us that day. Again, thank you for joining us. I don't think we have any questions. We hope you, again, will join us next month on October the 14th at 12:15. Our guest speaker is Buffkin Moore. He's a psychologist here at the hospital, and he's going to be providing you with a lot of practical information for caregivers of dependent adults. Mark it in your calendar and plan to tune in then. Thank you.